How many grafts will I need to get a good hairline? I'm 29 years old, male. I've been losing hair since the last 8 years, and currently the position is as in picture. How many grafts would be adequate to give me decent hairline? I generally keep short hairs.
Thank you for your question. You're 29 years old and you've submitted a very good photo, and you're asking about how many grafts you would need in order to build a good frontal hairline. I can certainly assist you with this question, and you also stated in your question that you started hair loss approximately 8 years ago. So my approach to helping you with this question would be just by describing how we approach patients like yourself in our practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan for over 20 years, and I am also the founder of TrichoStem Hair Regeneration Centers. This is a method that we developed in our practice of non-surgical restoration of thinning hair for both men and women with over 99% success rate, which was developed from our practice of performing hair transplantation, which we've been doing for over 20 years. So, in counseling people about hair transplant, I always start by first asking the question about age of onset and learning about their rate of progression. So in your situation, you started around 21, which means you probably started earlier than that. It's been my observation, it's generally well accepted, that if someone notices hair loss, they've already lost about 50% of their hair. Now, that being said, you have very advanced hair loss now at the age of 29. So you have to ask yourself, where will you be a year from now, 2 years from now? And that's where my concerns about stabilization have to first, is what I first bring in front of the patient. Because you can transplant hair, but the problem and limitation of transplantation is the number of grafts available from the donor area. And regardless of whether you use a strip method, whether you use follicular unit extraction, whether you use robots, whether you use any technology, the limitation is the true permanent zone in the back of the scalp. And if you just think about the baldest person you've ever seen, there's a very narrow band of hair. Hair loss doesn't just happen in forward, from the front going backward, but in the back it can actually go from the bottom upward. So you have to think about what do you have available. That being said, you also have to think what makes up a natural hairline. A hairline where there is continuity between the front and the sides looks a lot more natural than a hairline that's just a frontal hairline and the sides have dropped down. So when you think about it, it's very important that stabilization be established. Now, how do you do that? Well, there are two medical therapies that are approved in this country. One is the use of minoxidil, and the other is the use of finasteride. Finasteride is a pill that you take daily, and it falls in a category known as DHT blockers, or dihydrotestosterone blockers. Essentially, finasteride systemically will stop an enzyme called 5-alpha reductase to inhibit conversion of testosterone to dihydrotestosterone. The challenge is that only 60% of men will actually respond. And that's because only 60% of men may have DHT-sensitive hair loss. In addition, it's been generally well observed that finasteride doesn't stop progression, but rather slows it down. Now, it's an option. However, it's been our experience, and it's probably filtered by virtue of people who seek us out, 95% of the men who come to us don't want to take finasteride. And the reason is that they're concerned about long-term sexual side effects. And not only that, there's also an issue with compliance. So that being said, we actually help our patients before doing a transplant with this method we call hair regeneration. With hair regeneration, we're able to stop progression, reactivate hair that has not been growing, as well as induce thinning hair to shed and for thicker hairs to grow in. The limitation is salvageable hair follicles. Basically, when someone has male pattern or female pattern hair loss for that matter, as long as there's a follicle, hair regeneration can be of value. If the skin doesn't have a hair follicle, it won't be. So our goal is to stay in front of the progression so that any hair transplant can be maximally beneficial. Now that being said, when it comes to hair transplant, in a situation like yours where you fall in more of an advanced hair loss situation, I would say you have to be prepared to have more than one transplant. There's essentially a limit in the number of grafts you can have in one given session in terms of harvesting, and there's going to be a limit in the density. So when we map out a transplant patient or surgery, basically I'm drawing square centimeters on the front of the scalp in the area which will maximally allow for coverage that will help frame the face, and I measure the density and the number of hairs we have available, and then we try to maximize any given transplant. Typically, the strip method generates a lot more grafts than the follicular unit extraction method, and usually you get the most grafts from your first transplant. Now, of course, there's going to be lots of people who debate this, but again, 20 years of practice and having a lot of experience, I think it's still a reasonable statement to make. So I think you need to first think stabilization and then think about realistic expectations. When you're younger, there's always this desire to have more volume that is more in line with your contemporaries. There's something called the rule of decades that is generally applied. In your 20s, only 20% of your contemporaries have hair loss. Meanwhile, 80% have lots of hair. When you get into your 40s and 50s and beyond, well, more than 50% of your contemporaries have hair loss. So there's ways to actually try to make this so that you actually look good in the long term, because you can't keep up with the loss. So you have to do something for stabilization, and you have to be very strategic with the way the hair is transplanted. So learn about finasteride or medical ways to stabilize. Learn about the method I described called hair regeneration, and then look at that in the context of what a realistic outcome will be for you in terms of transplantation. It's not just about the number of grafts, it's about the coverage, and it's about where those grafts are placed. Remember, there's a mismatch. You can't get enough from that limited area to cover the whole scalp or even cover the front in a way that will give you a lot of volume. You want to basically create a natural looking framing of the face. So I hope that was helpful. I wish you the best of luck, and thank you for your question.